Is Alan Piper. I'm the senior politics producer. I'm supported today by our entire newsroom of producers who are all working under self-isolation from their respective homes. Most of us are in New York City, the global epicenter of the coronavirus pandemic. In this city alone, there are nearly 144,000 cases of COVID-19, and we've suffered over 14,000 deaths. While we are waiting for the president, we'd like to try to answer some of your questions, so please type them in the comments. Again, if you're just tuning in, I'm Alan Piper, and this is NowThis daily live fact check of the president's coronavirus briefings. We are expecting the president at any moment. He does not seem to be in a good mood today. You know it's bad when he's tweeting about Hillary Clinton and the Russia investigation. He retweeted someone earlier today calling her a witch. Regarding this so-called witch hunt, the Republican-led Senate Intelligence Committee just released a new report confirming yet again that Russia really did interfere in the 2016 election with the purpose of helping elect Donald Trump. Also today, the president tweeted about his approval ratings and the TV ratings for his briefing, saying, quote, "I've had great ratings my whole life. There's nothing unusual about that for me. The White House news conference ratings are, quote, through the roof. Monday Night Football Bachelor finale. But I don't care about that. I care about going around the fake news to get to the people." As someone who supposedly doesn't care about these ratings, he's tweeted about them 7 times in recent days and has brought them up repeatedly during the briefings themselves, including during the March 29th briefing, moments after warning the nation for the first time that the U.S. death toll from the virus could be over 100,000. Again, to date, the U.S. death toll is just at, or it's just near or above 44,000. That is roughly 10 times the death toll of the Iraq War. The U.S. death toll of the Iraq War. And of course, President Trump surprised and confused everyone last night with a tweet claiming that he would be signing an executive order to temporarily suspend immigration into the United States. So first, it's not at all clear that he can do that. Secondly, he hasn't done it yet. Tweets don't carry the force of law. He has not actually signed an executive order. But we're likely to find out more about what he has in mind when he comes out. But finally, the U.S. has more COVID-19 cases than any other country, and in fact, more than the next 4 countries combined. So if anything, they should be banning us. Now, we have the first members of the coronavirus task force out. I see Treasury Secretary Mnuchin standing off on one side and Dr. Birx and Stephen Hahn on the other side. Now here comes the President of the United States. We will do our best to fact check him in real time.
Everyone, a very big day today. I want to start by saying that our love and prayers of every American continue to be with our fellow citizens who have lost a cherished friend or family member to the virus. Amidst our grief, we're making tremendous strides against this invisible enemy, thanks to our aggressive campaign against the virus and the extraordinary talent of our medical professionals. Our mortality rate remains roughly half of that of many other countries and one of the lowest of any country in the world. And that's due to a lot of things, but our medical professionals have been incredible. Since we announced our guidelines,
it is not true when the president says that we have the lowest mortality rate, or one of the lowest in the world. First of all, as we've established, we have a higher raw death toll than any nation. The U.S. accounts for roughly a quarter of all the world's deaths. But our per capita death toll is higher than that of Iran, Germany, Austria, South Korea, Australia, or Japan, among other nations.
Today, as you know, and they're going to be doing it safely. They're going to be doing it with tremendous passion. They want to get back to work. The country wants to get back to work. A short time ago, the Senate passed the Paycheck Protection Program and Healthcare Enhancement Act with additional funding for the Paycheck Protection Program, hospitals, and testing. A lot of money for all of them, especially for our workers and our small businesses. My administration has worked aggressively with Congress to negotiate this critical $482 billion funding package. We reached a deal that includes $382 billion in crucial small business support to keep workers on the payroll, $75 billion to aid hospitals, which really need the aid, and very badly. Very proud of that. And $25 billion to support coronavirus testing efforts. I urge the House to pass the bill, and they're going to be voting on it, I imagine, very, very soon. I think while we're here, and so he's a very busy man, as you know, Secretary Mnuchin, he's going to be running back, so I thought we'll talk about that now, and we'll take a couple of questions on that, and then he can go and start phase 4 as the ink is drying. Probably they'll be voting tomorrow in the House, but shortly, and I think we have tremendous support. So, Steve, please come up, say a few words. Steve? Yeah.
Thank you, Mr. President, and thank you for all your work with us to get this passed. I'd especially like to thank Mitch McConnell and Chuck Schumer and the entire Senate for passing this. I'd also like to thank Kevin McCarthy and Nancy Pelosi, who have been working with us round the clock as well, and our Chief of Staff, Mark Meadows, who was also very instrumental in this. Let me just comment. We've had tremendous support for the PPP. This gives us another $310 billion for the PPP. We look forward to the House passing this tomorrow and being up and running quickly after that. This also gives us $50 billion for disaster loans, EIDL loans, that will allow the SBA to make $300 billion of disaster loans, all for small businesses. Also allows us, as the President said, more money to hospitals and unprecedented amounts of money for testing. And
I want to highlight that the money for testing was hard fought for by Democrats. Republicans did not want to include it. Republicans wanted to focus it only on the loans for businesses. Democrats insisted that there needed to be health care funding as part of it.
There is very broad participation in really small business. I will comment, there have been some big businesses that have taken these loans. I was pleased to see that Shake Shack returned the money. We will be putting out some FAQs. There is a certification that people are making, and I ask people just make sure the intent of this was for business that needed the money. We'll put out an FAQ. But again, the intent of this money was not for big public companies that have access to capital.
And not for Harvard, you might say.
So Mr. Secretary.
So we have reporting that shows that at least 75 large publicly traded companies did in fact avail themselves of these loans that were intended for small businesses, including at least one company that, while not a Trump company, had direct connections to Trump and his friends.
One of the largest endowments anywhere in the country, maybe in the world, I guess, and they're going to pay back that money.
And I just want to clarify, because certain people on the PPP may have not been clear in understanding the certification. So we will give people the benefit of the doubt. We're going to put an FAQ out, explain the certification. If you pay back the loan right away, you won't have liability to the SBA and to Treasury, but there are severe consequences for people who don't attest properly to this certification. And again, we want to make sure this money is available to small businesses that need it, people who have invested their entire life savings. We appreciate what's going on, and they're hiring people back.
And how are you going to ensure that those small businesses, those small restaurants, cafes, bars, who did not get the money last time around are going to get it this time?
Well, as I said, there are a million of these companies that did get it that are very small. We're working with the banks. We're extremely pleased that the small banks did great. 20% of the loans were made by banks of $1 billion and less, 60% by $20 billion and less, and the big banks also. We want everybody to participate. There's now a lot of money back in the program, and we look forward to all these small businesses getting access to funds. Brett is...
Now, the administration has routinely cast a rosier light on the rollout of this program to begin with. I'd like to remind people that many small businesses were not able to process applications, and even among those that did, more than 25% did not get the money from the last round before it ran out. That's even after they were able to complete an application, which many small businesses were not able to do.
We wouldn't have enough money. That's why we've worked with Congress for more money, and this is going to, we've already impacted about 30 million workers. There'll be a lot more, so we look forward to this having a big impact on the economy.
Yesterday, the president said he would look into the issue of felons, those with criminal convictions, getting access to some of these programs. I was wondering if you have an update on that.
Sure. So we worked with the White House on this. There were actually much more onerous restrictions in the SBA program. There were people who had misdemeanors that weren't allowed to access the program. It was much longer than 5 years. And, we very much, because of the criminal reform legislation that was passed and the work that's been done in the White House by Jared and others, we specifically designed the program, and the 5 years was significantly shorter than what had been done before. So we had already taken that into account.
Consideration of
For now, we're not going to do that. But I want to just emphasize, we did take this into account. There were a lot of people that wouldn't have access previously, and we changed those regulations.
Mr. Secretary, the President talked about a phase 4. I know we all understand the circumstances and why businesses need this, but how many more phases can we afford to have, or can businesses expect to have? Do you see a phase 5, a phase 6, a phase 7? What's your thinking on this?
Well, first of all, I very much appreciate the President's support for phase 4. He put out a tweet. As the President said, we would look forward to phase 4. Would be infrastructure. The President's been talking about infrastructure since the campaign. Roads, bridges, broadband, especially broadband now to rural America is very important. We've talked about incentives for restaurants, sports, entertainment, because these businesses have been impacted. The President has talked multiple times about a payroll tax cut. And we've also, we're talking about, in the case of states, we've heard from the governors and the fiscal issues of the states. I think phase 4 will most likely be what we need. I think based upon what we're seeing and the reopening of the economy and the amount of money we're putting in and working with the Federal Reserve on 13.3, I think you're going to see a lot of liquidity, and we look forward to business rebounding, especially later this summer.
Just
Be a big investment.
That's going to be
Size of the taxpayer dollars that are going out the door. You fellows come to a different way of thinking about the need for oversight, independent oversight on behalf of the taxpayer.
We have independent oversight. We supported in the last legislation. Let me be very clear. We have a new Inspector General. The President has already picked someone for that position. We look forward to the person being confirmed. We have an oversight committee of Congress that many of them have already been appointed. And let me just say, we put up last week for full transparency. We had no obligation to do this. We put up, you can go to treasury.gov, full transparency on the money that had been sent out on the PPP across states, showing all the big lenders, how it was distributed. No one lender did more than 4%, showed the businesses. So again, the President and I very much believe in full transparency. We're spending a lot of money, and we want to make sure that it's done effectively and fairly.
Now, in terms of where this money is going, I just want to highlight some of that. So the plurality of the PPP's dollars went to the construction industry. That was over 13%. Professional, scientific, and technical services received close to 13%. Manufacturing received just under 12%. Healthcare which is an area that might be most in need of this right now, received less than that, under 12%. And food services, these group of our society that are keeping food on our tables that we have deemed as essential workers, received only 8.9% of the loans from this program.
This is a real example of the country coming together to fight this virus.
What is your best understanding of what Mitch McConnell wants from an infrastructure package?
Again, I think we're not at the point of designing that. Like every other bill, we will work with senators on both sides on a bipartisan basis. I can tell you there's a lot of support, particularly for things like broadband and especially what's going on today. But the president has talked about, I was on the campaign with the president. We've been talking about bridges and tunnels and rebuilding this country for years. So the president wants to make a big investment in this.
Is this Mitch McConnell? Mr. Secretary.
What's really striking about this emphasis on infrastructure? So infrastructure is an area that under normal times you could actually find a lot of common ground between Democrats and Republicans. In fact, a lot of people believed that President Trump would lead with infrastructure when he was elected and that he would likely have a lot of support from Democrats. Instead, he chose to lead with trying to repeal Obamacare and pass a massive tax cut for the wealthiest Americans. But the thing about an infrastructure bill is that for this to help the economy, you're talking about people physically building things. You're talking about people stopping socially distancing to go dig tunnels and build bridges. And as many Americans remain under shelter-at-place rules, many Americans are just wondering where their next month's rent is going to come from. There has been this $1,200 issued to most working Americans, which is in New York City not enough to cover most people's rent, and that's a one-time thing, and it was supposed to have been all delivered by April 17th, and many Americans still haven't gotten it. And so it just seems to be an odd time to be talking about building bridges and tunnels.
The extraordinary situation where you saw the front month of oil futures trade negative.
Hi. On the issue of the fourth stimulus bill and aid to state and local governments, any thoughts on whether that money should be proportionate to the rate of infection in states so that harder hit states?
Interesting, but way too early to consider that. Whatever we do, we'll do on a bipartisan basis. The president has listened to the governors. I've had the opportunity to be on multiple video conference calls with the president and the vice president. We're reaching out to a lot of people. There's a lot of states that have been impacted, but way too early to figure out that level of design.
You mentioned if a large company applies for one of these loans and maybe manipulates or works the system or works the loopholes to get it, what are some of the consequences to, if a large company tries to get one of these PPP loans? What can you do?
Well, you used the word manipulate. I'm going to give people the benefit of the doubt. Again, we're going to put up very clear guidance so that people understand what the certification is, what it means if you're a big company. Again, there is a provision for, where there are multiple affiliates that people can access this, but the intent was not for companies that have access to plenty of liquidity and other sources. And again, if to the extent these companies didn't understand this and they repay the loans, that will be okay. And if not, there'll be potentially other consequences.
Can you talk about what those consequences?
So part of the issue here is that small businesses were defined by the number of employees at each location. So this is how a company like Shake Shack, which is a chain, or Potbelly Sandwich, was able to technically qualify as a small business because at each location they have fewer than 500 people, even though they have much more than that working for the companies overall.
And sending prepaid debit cards so we can get money out quickly to people. So everything that the president has had us working on is providing significant stability in the economy while we're dealing with this difficult time when, for medical reasons, we've closed down major parts of the economy. Thank you very much.
Now, Stephen Mnuchin made reference to the Inspector General who's supposed to oversee the spending of this money. President Trump fired the initial Inspector General, We know that he has a mistrust of inspector generals in general, and he has appointed the current EPA inspector general to do the job, which means he's doing both jobs at once, which is a pattern in the Trump administration. He wants everyone to be like Kirk on the Gilmore Girls. And so there is some concern that he will not be able to sufficiently oversee both the EPA and the spending of these funds.
Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad. We must first take care of the American worker, take care of the American worker. This pause will be in effect for 60 days, after which the need for any extension or modification will be evaluated by myself and a group of people based on economic conditions at the time. This order will only apply to individuals seeking a permanent residency. In other words, those receiving green cards, big factor, will not apply to those entering on a temporary basis. As we move forward, we'll examine what additional immigration-related measures should be put in place to protect U.S. workers. We want to protect our U.S. workers, and I think as we move forward, we will become more and more protective of them. This pause on new immigration will also help to conserve vital medical resources for American citizens. A short break from new immigration, depending on the time we're talking about, will protect the solvency of our healthcare system and provide relief to jobless Americans. Today, Vice President Pence visited the hardworking men and women of General Electric Healthcare in Madison, Wisconsin, who are working 3 shifts a day to quadruple their production of ventilators. We're way ahead of schedule on ventilators, as you know. That's why it's never brought up by the media. They don't like to bring things up when we're...
It is not true that we are ahead of schedule on ventilators. In fact, GM has said that it will not be able to fulfill the order that has been placed until August. Regarding the restrictions on immigration, we are looking into the president's claims, first of all, whether he has the authority to do what he's saying he's going to do. It is striking that the go-to reaction for President Trump in almost every situation is to try to restrict immigration.
And New York State will be continuing to control the testing of their citizens and will also manage their state and local laboratories. They have a lot of great laboratories there, more than anybody would ever have known, frankly. The federal government will work along with the state on the national manufacturers and distributors. Together, we'll all work together to help them secure additional tests, and we hope that this model will work with the other states as well. I think it will, for the most part.
I just want to highlight the difficulty that states have been having in getting the materials they need. The situation became so dire that the governor of Maryland, a Republican, negotiated personally with South Korea to get tests, to get 500,000 tests, because he couldn't get the materials that he needed with the help of the federal government. We know that other governors have been making similar complaints. In fact, the governor of Illinois chartered planes secretly to import medical supplies from China because he could not get them through the federal government's help.
As of about 2 days from now, will be more than doubled. Thousands of ventilators. In fact, so many ventilators that the governor is going to be sending up some to Massachusetts and a couple of other locations. We have a great deal of ventilators, which people thought would be impossible about a month ago. Thousands of hospital beds, and the USNS Comfort was sent, as you know, to New York, and it was originally for more of a normal medical purpose, and we changed it over so that it could take care of people that had the unfortunate circumstance of going through the problem that we know so well, unfortunately, that we know so well. I said from the beginning that no American who needs a ventilator would be denied a ventilator, and we have kept that promise all over the United States. Think of that. Other countries are desperate.
This is not true. We do know that there has been a rationing of ventilators. We do know that patients who needed ventilators in parts of the country have not been able to get them. We also know that thousands of the ventilators that the federal government delivered arrived broken.
We'll be bringing the ship back at the earliest time, and we'll get it ready for its next mission, which will, I'm sure, be a very important one also. But it was an honor. They reconverted it after it got there into handling an event that they were not expecting to be handling. The FDA has now authorized more than 50 diagnostic tests, including, as of late last night, the first test that a patient can take home. You can take it at home, and it's highly accurate. LabCorp intends to make the home collection kits available to consumers in most states with a doctor's order in the coming weeks. We also have 4 different antibody tests already authorized. Tests will help identify individuals who can donate convalescent plasma, thus providing potentially life-saving antibodies to American patients. Dr. Hahn will be providing you with an update on these developments in a few moments. He's done a great job at the FDA. We continue to gain ground in the war against the unseen enemy, and I see light at the end of the tunnel. I actually see a lot of light at the end of the tunnel, and we're starting the process. We're starting a very, very powerful, important process. You see that
the president is saying that there is light at the end of the tunnel. It is a little premature to say that. There have been 10,000 new cases in the U.S. since yesterday.
And with that, if I could, I'll ask Dr. Birx to come up, and then Dr. Hahn. Thank you very much.
Dr. Birx is going to speak now. The medical experts have been playing a smaller and smaller role in these briefings. Dr. Fauci has been essentially not seen in about a week since he came out a week ago to largely try to walk back statements he'd made on CNN, acknowledging that lives could have been saved if President Trump had acted sooner.
The Detroit Metro is doing quite well with significant declines now. New Orleans is nearly back to their baseline of where they started for new infections. We also are seeing improvements in Chicago and Boston, and that has been a great concern for us over the last several weeks, but they appear now to be flattening. Both also Philadelphia and Houston, Atlanta, Nashville, Baltimore, Indianapolis, and St. Louis also appear to be flattening. The D.C. metro area, we don't see a decline yet, so hopefully all of you are still social distancing and doing everything that you can. I wanted to remind everybody of 2 points. When we brought up and the president put out the guidelines for opening up America again, it was very clear to use data and to really work together to mitigate against any resurgence, and also critically to protect the vulnerable. And what we're seeing across rural America and in some of the smaller population states is we're still seeing outbreaks in long-term care facilities. And we asked everyone in phase 1 to make sure that they continued their social distancing in public, to ensure that the vulnerable with comorbidities and other conditions and among the elderly were staying at home, and making sure we're still providing service to them. But as individual Americans, as we begin to open up, we also made it very clear that individual Americans need to continue all of their hygiene pieces, ensuring social distancing, washing hands, not touching their face, and making sure that they're not bringing the virus home to vulnerable individuals within the household. And remember,
now, at the same time that the administration is urging Americans to maintain social distancing, President Trump has been actively encouraging the anti-social distancing protesters who have been taking to the streets in cities in states with Democratic governors.
Attention to the guidelines that were to be in all 3 phases. And so I'm calling on the states again to note that an informed community and knowledgeable community is a protected community. So make sure all of your states have your cases up, visible to the communities so they can make decisions and understand where the virus is in their community and understand how to tackle it with their state and local governments. This will be absolutely critical. And the surveillance that we called for to find asymptomatics before people get sick as an early warning signal. We ask for those to be in the federal clinics, in our inner city, more vulnerable areas, among indigenous populations, and of course in our long-term care facilities and prisons. We really want to support state and local governments to move forward on these critical monitoring to protect individuals that may be in the most critically vulnerable states. We will continue to see mortality and deaths among our American citizens, particularly in the cities as they begin to move past peak, because deaths will lag. And so we really need to continue to unite and really, really, really support our healthcare providers who are still on the front lines. They have been on the front lines now for weeks and weeks and weeks. And so no matter...
And I do want to highlight that the healthcare providers still do not have sufficient personal protective equipment. The president has suggested that they do, but we know from firsthand reports and from the Inspector General of Health and Human Services that hospitals across the nation are having a shortage of these supplies. And as a result, they are putting themselves at risk. The CDC has confirmed that there are at least 9,000 healthcare workers who have become sick with the coronavirus. Now, President Trump had previously suggested that the reason there was a shortage of medical supplies was because these brave doctors and nurses were stealing them.
Work that they do every day. So President Trump asked the FDA to remove all unnecessary barriers that were in place to help with the development of both diagnostics and therapeutics, and we have done that. I'm here to give you an update on FDA's efforts around serologic tests, which, as you know, are antibody tests, which detect in the blood the natural immunity that someone might develop in response to an infection, in this case COVID-19. These aren't diagnostic tests, but these are tests that actually detect the antibody, so an indication that one has had the infection and has responded. And I think it's important for everyone to understand that the timing of the response of the antibody to the infection isn't completely known, but we know that it takes some time to actually develop that. And there's two types of antibody responses that can be detected. And the antibody tests are just one piece of the larger response that you've heard in the America Returning to Work plan that the President has, with the task force, has developed. And this pandemic is truly unprecedented in nature, and you'll see reports around the world of different antibody tests that have been used. And I think that's a reflection of the fact that we're just learning and beginning to understand what that response looks like, and many of these tests have different characteristics that allow to detect at different points in the infection. I do want to address one issue that we are laser focused on at FDA, and that is in an effort to provide laboratories and healthcare providers the early access to tests. We issued a policy earlier in March that allowed test developers the opportunity to quickly get their tests to market and address the needs of the nation as posed by the epidemic. In March, we provided this regulatory flexibility to manufacturers, and here's what we required of them. The manufacturers had to validate their tests. We call it self-validation, similar to what many test developers in the world have done. They had to notify FDA that they had performed that validation. And then they had to label their products appropriately in the package insert with information about the validation, as well as the fact that it's not a diagnostic test, that it's an antibody test. And the bottom line here is that FDA still expects manufacturers and test developers to validate their antibody tests even under this revised policy. Now, we've done a couple of things to actually help end users, to help laboratories, providers, et cetera, states in terms of their use of these antibody tests. One is that we're working with CDC and NCI to actually validate some of the more than 90 manufacturers who've notified us that they brought their test to market, so to do an independent validation. And that process is going. We expect to hear more information this week about that, and we will provide that information in a transparent manner. We also want to go after anyone who is saying that the test has been authorized or has been approved by the FDA, but actually hasn't. And we've authorized 4 applications for antibody tests, and 140 test developers are pursuing applications for us as we speak. So it's not okay for someone to say that a test has been authorized or approved by FDA when it hasn't, and we are pursuing them both by in direct contact with the manufacturers, but also at the border. And so we have increased these interdiction efforts, and we will continue to outreach and do that with the manufacturers to make sure that we provide the most up-to-date information to the end users of these products. And we will continue to make all of our efforts, both in the diagnostics and the therapeutics, to help America open up again. Thank you, Mr. President.
Thank you very much.
Dr. Hahn?
Go ahead.
Dr. Hahn, you're speaking of 140 different developers, more than 90 manufacturers. How many of these tests actually work?
So as I mentioned, the 90 that have come forward and said they're marketing in the U.S., they are required by us to have self-validation, and they're required to label that appropriately in their package insert. And they also said that what we're doing is we're working with folks around the country, but here at home at the U.S. government with the NCI and CDC to validate some of those tests that have come forward to us. So we're actually doing some independent validation.
So far?
So we don't have those results yet. I expect to have more results this week, but we will be transparent about those results because I think it's very important. And your question is superb in that if someone wants to use a test that's come to market, really it's important to read the information that's in the package insert, but often in some of those cases it's also important for the independent labs to do the validation also. And you may have seen reports in the press of labs around the country that have done that. We've actually reached out to them, many academics, and we will be including that information in the information that we generate as well to provide to the American people.
While we have you here, there was a study out of the VA today on hydroxychloroquine that found a higher mortality rate compared to those who got standard of care. And I know this isn't a large-scale clinical trial, but since this drug is out there and people are using it, can you give some takeaways from that study? Did that change your thinking at all on hydroxychloroquine?
So this study is a small retrospective study at the VA, and similar to the data we talked about before with the French study, this is something that a doctor would need to consider as part of a decision in writing a prescription for hydroxychloroquine. And as I've mentioned from this podium and in other venues before, what FDA is going to require is data from clinical trials, randomized clinical trials, hydroxychloroquine placebo, to actually make a definitive decision around safety and efficacy. But the preliminary data are helpful to providers. And doctors, I want to ask them to incorporate the data as we have it come forward. And it's not definitive data. It doesn't help us make a decision from a regulatory point of view. But doctors should incorporate that in the decision-making they make on a one-on-one basis.
And just the timeline on the clinical trials and when we will be getting...
So this is in relation to this theory that President Trump has been pushing that hydroxychloroquine would be effective for treating the coronavirus. There is no clinical evidence that this is true, and as was highlighted here, the most recent study in a VA hospital actually showed an increase of deaths with use of hydroxychloroquine versus without. Prior to that, there were only a couple of tests, and they were inconclusive as well. President Trump, nonetheless, has suggested that people take it, saying, what do you have to lose? I think we've just highlighted something that you have to lose. Incidentally, President Trump has financial ties to at least 2 companies that produce the drug.
I'm wondering if Governor Cuomo brought you back any results.
No, we didn't discuss it, and I don't know of the report. Obviously, there have been some very good reports, and perhaps this one's not a good report, but we'll be looking at it. We'll have a comment on it.
A panel of experts at the NIH is actually now recommending against the use of hydroxychloroquine in combination with Z-Pak, which is something you've
we'll take a look at
recommended.
it. I'm always willing to take a look. Brett?
Another subject, you were signing of the executive order. When do you plan to do that?
The executive order will be, it's being written now as we speak, probably tomorrow sometime.
So will it have exemptions in there for
We'll have certain exemptions because you're going to need certain exemptions, but we'll be notifying you tomorrow. We'll sign it most likely tomorrow, being drawn now and tonight, and it's something we have to have in this country. We have to have it.
So for the people who say it doesn't track with opening up the country to shut down immigration across the board for companies that and the pipeline that's already in place. What do you say to that?
Well, I think it really does. I think it's very strong, obviously, and it's countrywide as opposed to specifically like China or some of the other ones that I've shut down. We're going to see, and you'll see a very accurate definition tomorrow after it's completed by the attorneys.
Last thing for me, North Korea. What can you tell us about the status of Kim Jong-un?
Well, these are reports that came out, and we don't know. We don't know. I've had a very good relationship with him. I wouldn't, I can only say this, I wish him well, because if he is in the kind of condition that the reports say, that the news is saying, that would be that's a very serious condition, as you know. But I wish him well. We've had a good relationship. I've said it many times. If somebody else were in this position, we would have been right now at war with North Korea.
That is an absurd suggestion to make. There is no evidence that a different president, I guess the president in question would be Hillary Clinton, would have started a war with North Korea. There is just simply no evidence to suggest that. President Trump has taken us closer to the brink of war with North Korea than we had ever previously been, with his threats to totally annihilate the country and his repeated jabs at North Korea's leader as Little Rocket Man. Later, apparently, in Trump's own words, they, quote, fell in love. They've had a series of meetings, but those meetings have not led to anything fruitful for the U.S., but have led to real concessions made by the U.S. in terms of both having a meeting in the first place and also reducing troop presence near the border in South Korea.
Better. But we had a very good meeting today. The governor and I had a very good meeting.
Is there more federal aid that can be used to help governors who want to expand testing? Because we keep hearing that all day long.
We have $25 billion, and that's a tremendous amount of money. That's much far more money than, in my opinion, that we'll need.
That $25 billion for additional testing that he's celebrating in this bill was hard fought for by Democrats. Republicans opposed it.
Country combined, and I think our people...
The president's saying that we've done more testing than any other country combined, and that is misleading. We are doing very poorly in terms of per capita testing. We have only tested about 1.2% of Americans. We rank 42nd, roughly, in the world in testing per capita.
But we're going to be reporting on that later on. It might be tonight or tomorrow. We'll give you an exact report.
You can say people who may be worried about the ability to bring immediate family members into.
No, I think it's been covered pretty accurately in this case. I think most people know what it is, and some people will be able to get in. We have to do that, obviously, even from a humane standpoint. But there'll be some people coming in. But it's a strong order. It's a strong order. It involves a big circle, as you know. Please.
Immigrants who are already in the country, are they at greater risk of deportation based on this order?
I don't think so. They're not supposed to be here. You're saying they're here illegally? Is that what you're saying?
Well, for example, if an immigrant is here for a court order, right, are they at risk of deportation?
Well, if a court order, then you have to go to court. So then the judge would make a determination as to whether or not they're going to be staying. But if they have a court order, they won't have to leave until they go through that process. So we'll see what happens. But with the court, and there are some with court orders, that means they have a trial coming up. Please.
So obviously on the immigration.
So the president just took a brief jab at undocumented immigrants again, as he frequently does. I want to highlight one of the things that has not become a total crisis for the United States is that we are not running out of food. And I want to highlight that roughly 1 million of our farm workers are undocumented, including between 60 to 70% of California's farm workers. These workers put themselves at grave personal risk to work in close conditions with few provisions made to protect them from the virus so that our food chain can remain intact.
The thing we want to do is take American workers' jobs. It's one thing when we were essentially, they used to call it full employment, And it's another thing right now. Right now, we have people that have lost their jobs, and we hope they're going to come back and come back fast, and then we can have an even deeper discussion. But right now, we have to have jobs for Americans.
Would you have any?
In terms of the impact of immigrants on the economy, I want to highlight that immigrants start companies. Who are the job creators? Job creators are the entrepreneurs who start companies. Immigrants start companies at twice the rate of Americans who were born here. The ACLU reports that immigrants pay more than $90 billion in taxes every year and receive only $5 billion in benefits, and so that's quite a plus for us. Now, those are just immigrants who are here with documentation. Undocumented immigrants also contribute significantly to state and local taxes. Many of them have tax payer numbers, even though they don't have Social Security numbers, and that they contribute an estimated just under $12 billion a year to state and local taxes, and contribute an estimated, anyway, I'm going to hear what Dr. Birx has to say, but I just wanted to provide that context on immigrants.
That we believe we can monitor communities at the community level by using the influenza-like illness and the syndromic respiratory and gastrointestinal components of this particular virus. Obviously, when we have flu, we're working on an algorithm that you test for flu and then you test for COVID, and making sure that we are building the testing capacity to be able to do that, because I think it's very important that you're going to be able, on the surface, a patient when they come in with early flu and early COVID can look very close to get identical. So we need to have testing in place to be able to separate and ensure those patients receive the best treatment. We're also hoping by that time that we have additional treatment options for people with COVID-19, so that there will be additional treatment available in the fall.
Your message would be to prepare for that time, thinking that it'll come back together?
The President has made it clear that we have the emergency, which we have been working on, the opening up guidelines, and just like he talks about phase 4, he has us very much working on the next 60, 90, and for all on with fall, and that's why he's not stopped any of the ventilator orders. It's very important that we have a completely refreshed and a comprehensive stock.
I want to highlight Dr. Birx is again bringing up the likelihood that this is going to be with us in the fall. That is going to create some challenge for the November election, because elections require people to come and congregate in small spaces. This is why Democrats have been pushing to create provisions to vote by mail now, and Republicans have been fighting against that. And unfortunately, this isn't something that can be put in place at the last minute. And so we could be entering a scenario where, as we saw in Wisconsin, the people who are going to have to make a decision between their right to vote and the right to their own health.
Americans are about immediately reverting to all of those issues that they need to do in order to ensure that they're protected and their families.
And Mr. President, what do you say to the concerns like Georgia is opening up barber shops and bowling alleys and the like, and you saw Lindsey Graham is saying he's concerned that Georgia may be going too far too fast and it could affect people in South Carolina. Obviously, people travel back and forth between states. How do you protect the people of South Carolina, for example, from a potentially bad decision by a governor in Georgia?
So he's a very capable man. He knows what he's doing. He's done a very good job as governor, Georgia, and by the way, and South Carolina. Governor McMaster also. So you.
It is striking that President Trump always praises the Republican governors, even when they are taking actions that go against the advice of his own medical advisors.
I mean, we've got those concerns. And as far as coming back, if they do come back, and they could come back together with heavy on the flu and much lighter on, because I really believe we'll be able to put out the fires. You know, it's like fires. And we've learned a lot. You know, we've become very good at this. When you look at what's happening, when you look at the numbers coming down, a lot of states are in really great shape. You're going to see a lot of openings.
Again, I want to highlight that there are at least 10,000 new cases in the U.S. since yesterday.
Prepared for going back to social distancing, even if things relax over the summer, but come the fall, if the virus comes back in coincidence.
Well, I could see them, and I'll speak for the doctor, and if you'd like either of you to say, but I would say that you keep away until this thing is gone. It's going to be gone at some point. It's going to be gone. And I would say you keep away and you do the social distancing until such time as you know it's gone. We'll know when that time is.
Your executive orders to
We'll know when that time is, not if we don't have widespread testing.
Economy, we'll see where we are with the economy, basically, and I think I'll have a very easy decision to make. I hope that the economy is going to be great by that time, but we'll see. But right now, in light of the fact that Americans are out of jobs, I can't be taken in.
roll it for another 60 days or?
Well, I could roll it for 30 days, or I could roll it for much more than 60 days. We'll have to take a look at the time, but we'll be looking at 60 days, and we'll see what it is. Yeah, in the back.
And there is reporting that you...
Under immigration order.
That's all right. You go. Why don't you go, and then you.
Okay, on the immigration order, we'll continue with that. There is reporting that you may actually sign a second order to even limit more of those exemptions that you were just talking about. Can you confirm that you are considering?
It could happen if I want, but I won't be doing it tomorrow. I'll be signing the primary order, and then we have a secondary order that if I want to do that, we'll make that determination. We can do that. Yeah, we can do that at a little bit different time if we want.
But that is under consideration at this time, the second order?
Secondary orders, yeah. Please.
Thank you, Mr. President. I have two questions, one from me and one from a reporter who couldn't be in the room because of social distancing.
One from you, one from
That's the seat. This is a pretty good seat. So my first question is about your immigration order. You campaigned on reducing legal immigration. I remember your speech in Phoenix in 2016 on reducing legal immigration.
Oh, I campaigned on legal and illegal, but no, I've always said you have to come into the country legally, so not legal. What I campaigned on was people just flooding our border and stopping. And by the way, speaking of that, we have 170 miles, almost 170 miles of very powerful border wall up, and it's...
Okay, this is not true. According to CPB, we have only about 1 new mile of border wall constructed.
With them, and Mexico's been terrific. They've really helped.
You also campaigned on reducing legal immigration. And I'm wondering if some critics are saying that you are using the virus now in this crisis to follow through on that promise to reduce legal immigration.
No. Well, I want people that are in this country, I want our citizens to get jobs. I don't want them to have competition. We have a very unusual situation where something came in that nobody has seen for many, many decades. Probably 1917 would be the closest analogy if you look at it, when you look at the contagion, the kind of contagion we're talking about. So no, I'm not doing that at all. I want the American worker and our American citizens to be able to get jobs. I don't want them to compete right now. There's a big difference when we have a full economy, and frankly where some of the companies, we have many companies moving in where they need workers. That's a big difference between that and where all of a sudden a lot of people lose jobs.
As you know, a lot of farmers rely on seasonal migrant workers that come in on the
affected. The farmers will not be. That's an important point. The farmers will not be affected. Yeah, that's a very important point. I mean, it's a great point, actually. I'm glad you brought it up. No, the farmers will not be affected. They've had cases where they stopped everybody from coming in, and all the farmers went out of business. They were literally out of business. You remember that, Brett? It was not so long ago. But it's easy. It's easier to stop everything cold than it is to plan it so that the farmers have the people that have been working on those farms for many years, and that's what we're doing. No, the farmers will not be affected by this at all. If anything, we're going to make it easier, and we're doing a process that will make it better for those workers to come in, to go to the farm where they've been for a long time.
Now, for a question from a reporter who's out of the room, this is from the Washington Times, Tom Howell. Why hasn't the CDC, the federal government's main disease-fighting agency, had a more public-facing role amid the pandemic? It was holding regular media calls early on, but has not held one since early to mid-March.
Well, I can't tell you that. CDC has been terrific. We've worked with them very closely. They were very much involved, even in the border decision that I made last night. And the directors...
It's hard to imagine that the CDC would have been involved in the border decision, since the border decision does not impact the cases. I want to highlight that the U.S. has more cases than any other country in the world. Roughly 31% of the world's cases. The U.S. has more cases of coronavirus than the next 4 countries combined. Closing down immigration is absolutely not, at this point, a method of stopping the virus from entering the country. It is here.
CDC director saying that these protests are not a good
Well,
idea.
people, look, it's not a question of helpful or not. People want to get back to work. And I've watched some of the protests, not in great detail, but I've seen that, and they're separated. There's a lot of space in between. I mean,
This is not true. The protesters are not putting a lot of space in between them. They are, in fact, in Michigan, they even closed off the entrance into a hospital so that an ambulance couldn't get in. There is an iconic photograph of protesters jammed against the door of a Capitol building. It is simply not true to suggest that they're practicing social distancing.
both are unfortunate, but you have a lot of people out there that are anxious to get back. Yeah, please.
Surveys seem to be indicating that people are actually more concerned. More people are concerned about the virus spread, and they don't want to go out.
Yeah.
They
No,
don't want
that's
to go to
true.
work. They
They're
don't want
both.
to go outside.
They're 2 groups. They're big groups, both of them.
So my question is, what good is it for these businesses that would reopen if the customers are
Well,
afraid
at
to
the
go
same
outside?
time, we have to build back our country, and I'm going to make our country bigger and better and stronger, and we have to get started. There's a big difference, though, because people have really been through a lot, and they understand what to do now. Before, nobody had ever heard of a thing like this, wouldn't you say? I mean, nobody ever heard of a thing like this. Distancing, social distancing, what does that mean? Washing your hands every 15 minutes, what does that mean? I mean,
It is not true to say that no one had ever heard of any of this. It's certainly not true to say that no one had heard of washing hands before.
of it. But you have people, you can't break the country. At some point, you have to go back. Now, hopefully the governors are going to do, because I want the governors, and I've always wanted that. You could call it federalism, you can call it whatever you want. But the governors, I want them to do it. If we see them doing something we don't like, we'll stop it very quickly.
Okay, so there are several things here. He's saying that he wants the governors to take the lead, but he is actively working to undermine multiple governors. He tweeted out, liberate Virginia, liberate Michigan, liberate Minnesota. That is actively working to undermine the governors of those states. And he just expressed support for the governor of Georgia, who is opening things up on a faster timetable than even President Trump has suggested should be put forward. Georgia has added 1,000 new cases of coronavirus, roughly, since yesterday. That is not an indicator that it is the appropriate time to reopen hair salons and tattoo parlors. Furthermore, the president says the country wants to go back to work, and I do want to highlight that a recent Gallup poll said that the vast majority of Americans would prefer to wait and see what happens with the spread of the virus. 71% of Americans did not feel safe going back to work until they know that the virus is more contained.
The data, remember we wanted this data and evidence-based, the data that they utilize to make decisions and the data that the mayors should use in each of the communities, because it will have to be on a community by community opening, because there are different communities in different places, even in Georgia. And so I believe people in Atlanta would understand that if their cases are not going down, that they need to continue to do everything that we said, social distancing, washing your hands, wearing a mask in public. So if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative. So I'm not going to prejudge, but we have told people very clearly, and the president guidelines made it very clear about the expectations of phase 1. And remember, phase 1 also included social distancing in restaurants, social distancing in every place that was entertainment, and keeping your own individual social groups to less than 10. I mean, we've been very clear in the guidelines, and I think it's up to the governors and mayors to ensure that they're following the best they can each of those phases to make sure that both the public is completely protected. But the governors and mayors also need to communicate very clearly on the data that was used for decision making and make that transparent and available to their communities.
And it also depends, as an example that you just gave, are they doing testing before they go in? We have to find that out. That's why I'm speaking to the governor a little while, and I'll be asking him those questions. Please, go ahead.
Thank you, Mr. President. Just trying to get a sense of what you have left in the toolbox as it relates to oil. You hashed out the deal with OPEC Plus. You've ordered for purchases into the SPR. I mean, what else can be done?
Well, the biggest thing in the toolbox is to get our country open. That's by far the biggest thing there is. If we can open pretty well, and I think we're going to, over a period of time, piece by piece, a puzzle, remember? If we can open well, I think that's your biggest part by far. That's where the engine is, more important than any other thing that we can work on. Please, go ahead.
Now, the president is addressing the collapse of the oil market. I want to highlight that just days ago he was bragging that he'd saved it, saying that he had negotiated, quote, maybe the biggest oil deal ever made. Yesterday, oil markets hit record lows. At one point, a barrel of oil was worth negative $37. That is to say, if you would take a barrel of oil, you could get paid $37 to take it.
As a New Yorker, have any
Frankly, that sounds like a good idea to me. When it's all over, that sounds like a great idea. They deserve it. They're warriors. They've done an incredible job. We mentioned briefly the state aid. We talked about that, Governor Cuomo and myself, and I agree with him on that. And I think most Republicans agree too, and Democrats. And
I want to highlight that New York has received proportionately less than anyone else. Governor Cuomo had highlighted that states like Wyoming were receiving approximately $300,000 per coronavirus patient, while New York was receiving about $12,000. And I want to highlight also these $1,200 individual stimulus payments in New York. That doesn't cover a month's rent for a one-bedroom apartment. In Mitch McConnell's Kentucky, that could cover the rent of a three-bedroom house for a month.
much of it is going to be made here. Hopefully, at some point, all of it's going to be made here. John?
Mr. President, at that podium back on March 9th, Vice President Pence said that over 1 million tests had been distributed, and then he said, and this is an exact quote, before the end of this week, another 4 million tests will be distributed. As you know now, 6 weeks later, we still aren't at 4 million tests.
I don't know what to say.
With the testing.
Ready? Are you ready? Again, I'll say it for the 5th time. We have tested more than any country in the world, and some of the countries are very big. Okay, more than any country in the world. We have one of the most successful.
So we rank about 42nd in the world for testing per capita. We are testing roughly 150,000 people a day, which may sound like a lot, but in a country of 340 million, it is not. Harvard researchers estimate that to safely reopen the country, we would need to be testing at about 500 to 700,000 tests a day. As highlighted, the Vice President had said that we would have completed over 4 million tests weeks ago. It's just crossed over 4 million now. That's 1.2% of the population.
The phase one of this China deal, the flight ban is still in place. How confident are you that the Chinese are not going to invoke the natural disaster clause to just wait before getting into there?
Well, we're going to see. Look. There's nobody ever been tougher on China than me. And that means for 20 years, you go back.
This is not true.
Probably got elected, at least partially, on the fact that I've been very tough. I said China's been ripping us off for years. I'd go into Michigan. I'd go into Pennsylvania, make speeches unrelated to being a politician. I'd be invited. I'd be speaking to people, which I like to do because I love the people. I love the people of this country. And I'd make speeches. Nobody...
President Trump has had varying views on the people of this country. At a rally in Fort Dodge in 2015, at the beginning of 2016, he pronounced how stupid are the people of this country.
200 billion, 300 billion, 400 billion, 500 billion dollars a year. How did they ever let a thing like this happen? Now, if you look at this last year, the deficit went way down. And I'm talking about even before. Now it's much different. But a lot of things are happening. Great things were happening. Except all of a sudden, out of nowhere, came the invisible enemy. And we think we know where it came from. And we'll be talking about that probably a lot.
Okay, so the president seems to be suggesting another conspiracy theory with we think we know where it came from, but I just want to highlight he was talking about how we had an $800 billion trade deficit with China. That is not true. There has never been a trade deficit with China close to that. The 2018 deficit was $381 billion, which you can count as $420 billion when counting goods alone. But for goods and services, the trade deficit was $381 billion. And then I also want to highlight that a trade deficit, President Trump repeatedly phrases it like they owe us that money. And I don't know if he's intentionally misrepresenting what a trade deficit means or if he doesn't understand it himself. It just means that we are buying more things from them than they are buying from us. And that is typically because they are offering it at a lower price. Now, it is very striking to hear that described as taking advantage of us. I don't think any one of you watching has ever walked into a store and complained that the store was taking advantage of you because they were charging too little.
Some of the workers on the payroll to help, instead of sending them to the federal other companies do that.
Yeah, in Doral, you're not allowed to have the golf courses open. You can't have the clubs open. You can't have anything. It's a big hotel and resort. And I think there's probably 750 people. So you can't have anything open. And you say, what are we going to do? Have full payroll and have the whole place with, there's no income coming in. First of all, everyone's home, and they're supposed to be. Second of all, in Florida, you can't use golf courses. That one I'm not sure I agree with. You have parks and golf courses where you have open space, but that's what it is. So I have others also. Then I have others in different states. I have a lot of different properties. But again, my children run them, and I love my children, and I wish them well. I look forward to comparing my numbers to my children's numbers. I think I'll do better.
You haven't thought about asking if
you understand that? Well, the closed property is like, you have to close them up, and then hopefully when things get better, we'll just open it up. But you can't have many hundreds of employees standing around doing nothing. There's no customer. You're not allowed to have a customer. So in some places it's very strict. New Jersey's strict. New York is strict. And you have to do what you have to do. And it's too bad. I feel so badly when I see that. I think that it's a tough policy, but I go by whatever the policy. That's a state policy in the case of Florida.
So that is President Trump bemoaning the fact that at this moment when 44,000 Americans have lost their lives and over 22,000 Americans have over 22 million Americans have lost their jobs, President Trump is bemoaning the loss of business that his golf clubs have suffered. President Trump, who is calling on businesses to keep employees on the payroll, his organization has laid off at least 1,500 workers. It's also important to note that while he owns multiple hotels around the nation, and while many hotels have offered their hotel rooms for various purposes, such as providing temporary housing for medical workers so that they do not go home and pose a risk to their family, President Trump's and his hotels have not made such an offer in a single instance.
Do you have a message for people in Georgia who are soon going to have a choice about going to the hair salon or the nail salon or getting that tattoo if they're not 6 feet apart and they're not able to follow these social distancing guidelines? What's your message to people in a state like Georgia?
Well, we made it very clear in a message to all of the American people with opening up America again, the criteria that we wanted states to follow. Those were careful criteria. There were only 6. They were carefully selected in conversations with epidemiologists around the world. And
so, Dr. Birx, President Trump's medical advisors have to walk a tightrope of not politically criticizing the people who are not following the medical guidance. Now, the question was about the state of Georgia. Georgia's Governor Kemp is opening up non-essential businesses again. The guidelines put forward by Dr. Birx and the team require a 14-day period during which an area is shown to have a decline in reported cases. As I mentioned, Georgia had added 1,000 new cases since yesterday. So it is not meeting that criteria, and yet it is reopening the businesses. And this puts a terrible burden on the workers at those businesses, because most workers in America do not have paid sick leave. They can't just not go to work if they feel unsafe. If the business opens up and their employer calls them in, they have to go in. They have to give those haircuts that are being offered at the hair salons. And if it were only the people who choose to go and do things who are putting themselves at risk, then we could say, great, take that risk with yourself. But they put everyone else at risk. And in Georgia, as in so many states, we see that the risk is disproportionately borne by the black population. Black Georgians make up just a little under a third of the state, but they make up more than half of the coronavirus deaths. And so the decisions that this governor is making are impacting people beyond himself and beyond the people who are saying that they personally want to return to work.
Very careful. We don't want that to happen. It could happen. I think we'd stamp it out if it does happen. We're not going to be doing any mass closings, I hope. So I think we could, I call them some burning embers, and we put them out. And I think we've gotten very good at that, but we'll see. But we don't want that to happen, no, absolutely.
You concerned, Mr. President, once the reopening happens, we won't need to go back into reclosing.
I don't want to do that. You don't want to do that. Nobody in this room wants to do that. You look forward, I think, Brett, very soon, and John, sitting next to a lot of your fellow reporters, right? The room seems so empty this way. But it's one of those things. Yeah, go ahead.
Now, Dr. Fauci in particular has highlighted that the danger of reopening too soon would be the likelihood of a second wave. And that second wave is also going to be harder to, in addition to the loss of life, it's going to be harder to recover from economically. Because if our leaders tell people, hey, it's safe to go back to restaurants and hair salons and theaters, go do it, and then people start dying, how soon do you think they're going to want to go back to those businesses when they are finally opened a second time? Dr. Fauci has warned that a premature reopening of the country would add tens of thousands of additional deaths and extend the overall period of shutdown by many extra months.
It's going to be an incredible thing taking place. I think it's going to be a renaissance. We're going to have something that will be, a lot of people are going to go to work building those roads and bridges and tunnels and highways and all of the other things we're going to be building. And broadband for the Middle West. I mean, the farmers haven't been treated fairly. Let's face it, the farmers have been treated terribly when it comes to the internet. So we're going to take care of that. We're going to make them very...
One of the biggest problems farmers are actually facing at the moment is that they aren't able to sell their goods to Europe and China because of Trump's trade war.
Get on, Mr. President.
We want to have you back soon. Thank you very much. Thank you, everybody. Thank you.
All right. Well, this seems to be a shorter than usual press briefing. Also, a little less angry than usual. I don't know. I don't know what accounts for that, but I am relieved on everyone's part to be able to allow our team to sign off a little earlier this evening. Now, again, the biggest piece of news to come out of today is that the president has said that he's going to be restricting immigration. It appears that the president has broad authority to restrict entry into the United States, a point that the Supreme Court has affirmed in upholding his controversial travel ban in 2018. And that power is perhaps no greater than during a public health emergency. So we will have to pay attention to how this develops. But again, I just want to highlight, because this is a president who has repeatedly scapegoated immigrants, and I just want to highlight, first of all, immigrants are by definition the origin of the United States. If you are not a Native American, then you are a descendant of someone who either came here or was brought here, and that is who has made our modern United States. Immigrants, as I said, start companies at twice the rate of Americans who were born here. We always highlight that people who start businesses are the job creators. We want more jobs, then we need more job creators. Statistically speaking, immigrants are the most likely people to create those jobs. As I highlighted, immigrants pay more than $90 billion in taxes every year and receive $5 billion in federal aid. And that's just talking about documented immigrants. Undocumented immigrants contribute nearly $12 billion to state and local taxes. They pay a nationwide average estimated tax rate of 8% of their income. To put this in perspective, the top 1% of taxpayers pay an average nationwide effective rate of 1%. So undocumented immigrants are paying a greater share of their income than the richest Americans in this country. And most especially at this time when we are relying so heavily on essential workers in the food industry to provide the food that is on our tables. The one thing that has not gone wrong in this crisis for America is that we are not experiencing food shortages. And that is largely because of immigrant workers, both documented and undocumented. As I've mentioned, undocumented workers make up roughly 1 million farm workers in this country, including between 60 to 75% of California's farm workers. Undocumented immigrants work as the people who deliver the food to you. They work in the restaurants where your food is made. And documented immigrants also make up a huge proportion of the food service industry, the people who are keeping food on your table, on my table, on all of our tables. So it is especially important at this moment that we must not in any way demonize those people who are keeping us fed. So that's today's briefing. Thank you for joining us. I am hearing right now, I imagine you can't hear it, but I am hearing the cheers of New Yorkers, my neighbors, leaning out of their windows to cheer on the brave medical professionals and essential workers who are keeping us alive at the risk of their own health. I want to thank you for joining us. I am NowThis senior politics producer, Alan Piper. I had support from our full team today, most especially Brandon Caruso, Jackson Davis, Zara Heder, Kavish Harjai, Matt McDonough, Ian McKenna, and Shelby Vaculin. To everyone out there, please stay safe, take care of yourself, check in on the people you care about. If you are missing your friends, contact them, find out if they're okay. And especially, please let the people that you love know that you love them. We are going to get through this together. If the president is back tomorrow, we will be back to live fact-checking. I'll see you then. Thank you, and good night.